Our next section is viral infections. Now the most important thing is to remember that when these yellow eyes look at you, you can't tell which infection it is. Look at Mr. Scleral icterus here. Now all we know is that the guy's got jaundice. We don't know whether the bilirubin is 12, 2, 22. We just know it has to be above 2 to 2.5 because you don't get jaundice until you get an infection about 2 to 2.5. Now the first thing is this. Once somebody has jaundice, once somebody has scleral icterus, you cannot tell which organism it is until you have specific diagnostic testing. In other words, you cannot make a distinction between the causes of hepatitis based on the fact that someone is yellow. If someone has dark urine, if someone has light stool, if someone has dark urine, light stool, if someone has a big liver, a big spleen, dark urine, light stool, weight loss, if someone has all these things, has a big ALT, big bilirubin, that can be any form of hepatitis. You can't tell them apart. So this guy here, let's look at this picture, Mr. Acute Hepatitis. You can't tell which one he has by looking at those pictures. This guy here, Mr. Acute Hepatitis, you can't tell which one he has by looking at that acute pictures. All you know is that he's yellow. This here with chronic hepatitis in the person, we know it has to be hepatitis B or C or D because you don't get chronic hepatitis from hepatitis A. These veins here, this is called the caput medusa. This is basically that portal systemic shunt that happens when somebody develops cirrhosis. So these veins here going from the umbilicus to the xiphoid process is a caput medusa that happens as a sign of your liver being all cirrhotic. Now, we don't know which one of these you have until such time as you get diagnostic testing. For instance, hepatitis A and E are both transmitted by food and water. Both of them are acute, self-limited diseases. The only thing that's significant about hepatitis A is that you can get it in travelers, and travelers should be vaccinated. Travelers don't have to be vaccinated against hepatitis B unless the traveler is planning on having needle sharing and unprotected sex. You can't get travelers' diarrhea from travelers don't get hepatitis B at a restaurant unless they're sharing a needle with the chef. You can get hepatitis A at a restaurant, but you can't get hepatitis B. So travelers should be vaccinated. Travelers should be vaccinated, okay, against hepatitis A. Travelers should be vaccinated against hepatitis A. So travelers should be vaccinated against hepatitis A in order to protect them from getting food-borne infections as they're traveling. Okay? So therefore, the person who has hepatitis A and E, who is the person to get the worst form of E? And that's people who have pregnancy. Okay? So if that's hepatitis E, that's pregnancy. Okay? Pregnancy. The worst one, the most likely to develop fulminant hepatitis E is pregnancy. It's still food and waterborne. Also, like most acute forms of hepatitis, there is no particular therapy for it. You diagnose hepatitis A, E, matter of fact, all of them except B, by looking for IgMs acutely and IgGs chronically. However, there's no therapy for hepatitis A and E. For hepatitis B, C, and D, well, for hepatitis B, C, and D, there is, for hepatitis B, C, and D, the treatment is for acute hepatitis. There is no treatment for acute. The acute versions have no particular therapy. There's no particular therapy for the acute. However, for people who have hepatitis B, C, and D, these are transmitted through blood, needle sharing, transfusions, sex, perinatal, blood, sex, perinatal, blood, sex, perinatal, blood, sex, and perinatal. Blood, sex, and perinatal. Okay? Blood, sex, and perinatal for hepatitis B, C, and D. Blood, sex, and perinatal. Okay? So therefore, this is very, very different than food and water. Food and water, travelers can get it in routine contact, can get it at a restaurant. Vaccinate me, vaccinate me. The vaccine for hepatitis B is very specific. Who's exposed to blood? Healthcare workers, commercial sex workers, blood product recipients. Blood product recipients. Both people who should be vaccinated, both should be vaccinated if you have chronic liver disease. Anybody with chronic liver disease should be vaccinated against both chronic liver disease. Now, the diagnostic test for all of them except hepatitis B is simply also IgM acutely, IgG chronically. IgM acutely, IgG chronically. IgM acutely, IgG chronically. Blood, sex, perinatal. Not food and water. Not food and water. What is the most common cause of needing a liver transplant in the United States? What is the most common cause in the United States of needing a liver transplant? And the answer is hepatitis C is the most common cause of needing a liver transplant. In fact, it's not alcoholic cirrhosis. The most common cause of needing a liver transplant in the United States is actually chronic hepatitis C. The hardest part is the diagnostic testing for hepatitis B, because hepatitis B has surface antigens, has E antigens, has core antibodies, has surface antibodies. The others don't have cores and E's and surfaces. The others don't have cores and E's and surfaces. The others just have IgM acutely and IgG chronically, not cores and E's and surfaces. Let's look over here. A, B, C. Surface antigen positive, E antigen positive, maybe core antibody positive. Core antibody positive, surface antibody positive, just surface antibody positive. Well, what about these? Negative, 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 negative. A, B, C. Which of these represents a person who has acute hepatitis B? Which one is the acute hepatitis B? And the answer is A. A is for acute, because acute hepatitis B, you're going to make surface antigen. You should make E antigen, but the biggest thing about E antigen is that E antigen, although it means early, E antigen is your most direct way of knowing the amount of viral replication. E antigen is your most direct way of knowing the amount of viral replication. E antigen is your most direct way of knowing your amount of viral replication. E antigen, surface antigen, E antigen, acute. Now, which of these is the person who has chronic hepatitis B? The answer is the person in A. The person in A is the person who has chronic hepatitis B as well. It's all based on this surface antigen. If that surface antigen persists for longer than 6 months, then you have chronic hepatitis B. Then you have chronic hepatitis B. Then you have a chronic hepatitis B. If it persists for longer than 6 months, then that's chronic hepatitis B. Surface antigen for greater than 6 months. Surface antigen for greater than 6 months is chronic hepatitis B. Now, chronicity is not based on E antigen, on core. You could be antigen negative, you could be core IgG, core IgM. The chronicity is based on surface antigen. You could have E antigen, but you might not have E antigen. In other words, I can't tell whether the person with A, surface antigen, E antigen, and core, I can't tell whether that's acute or chronic hepatitis unless you tell me the time course of the persistence of those blood tests. I can't tell unless you tell me the time course. I can't tell unless you can tell me the time course. I can't tell. Who is the person in B? Core and surface antibody. The person in B is the person who's had old, past, healed, cured. The person in B is the person who has had old, past, healed, cured. That person makes core antibody and surface antibody. Core antibody and surface antibody. And the person in C is the person who's had a vaccine. The person in C is the person who's had the vaccine. Vaccinated people just make surface antibody. Old, healed, cured, passed for core and for surface. For core and for surface. Okay? For core and for surface with each other. Okay? For core and for surface. Old, healed, passed, cured. What does E antigen mean? It means DNA polymerase. E and DNA polymerase. What E antigen means is it means DNA polymerase. What E antigen means is it means DNA polymerase. Okay? E antigen is the same way as saying DNA polymerase. E antigen, DNA polymerase. Okay? So when you see these, E antigen and DNA polymerase, this is saying that if you have E antigen, you're more likely to transmit. Let's look at it this way. If you have a pregnant woman that's surface antigen positive and E antigen is positive, 90% of her children are going to get the disease from her. If you have another pregnant woman whose surface antigen is positive and whose E antigen is negative, only 10% of these people are going to transmit. E antigen tells the degree, the amount of the DNA transmission, of the DNA polymerase, of the replication. Surface antigen, E antigen, 90% transmission. Surface antigen, E antigen negative, 10% transmission. E antigen determines the degree of viral transmission, DNA polymerase. Now, what is the treatment for people who have chronic hepatitis C? Well, the answer is interferon and ribavirin. Well, interferon and ribavirin is the treatment for hepatitis C. What's the most common adverse effect of interferon? Well, that's probably the single most likely question. The most common adverse effect of interferon is flu-like symptoms. Aches and pains and myalgias and arthralgias and feeling creepy and cranky and grimy. Don't touch me, I'll kill you. The most common adverse effect of interferon is flu-like symptoms. The most common adverse effect of interferon is flu-like symptoms. The most common adverse effect of ribavirin is red cell anemia. Ribavirin, anemia. Interferon, flu-like symptoms. Interferon, depression. Interferon, aches and pains and crappy. You know how when you have the flu and you feel achy and painy and irritable and you touch me and I'll kill your whole family? Well, that's interferon inside your own body. And interferon inside your own body. Interferon inside your own body is what's causing that achy, painy, crappy, creepy, lousy, depressed feeling. Now we whip it up in a laboratory and give you 1,000,000 times more. No wonder you feel like committing suicide. In the future, people look back and say, wow, you guys used to give interferon to people? Wow, barbaric. But that's the best we have right now. Beats dying of cirrhosis. Interferon and ribavirin. Well, the treatment for hepatitis B is different. That's different because it's not interferon and. It's interferon or blamivudine or entecavir or adefovir. I bet you're sorry you asked. Oh my God, what's entecavir and adefovir? They're two drugs you never heard of. That's what they are. Entecavir and adefovir are the two latest, greatest, newest antivirals against hepatitis B. Interferon or lamivudine or adefovir or entecavir or. Interferon or adefovir or entecavir or any one of these things. Any one of these things. Interferon or lamivudine or entecavir or adefovir. Any one of those things can be useful to you in the treatment of chronic hepatitis B. Are these most effective for people who have E antigen positive or E antigen negative? They are most effective for people who have E antigen positive because then they are working to block the DNA polymerase the most. They are working to block the DNA polymerase the most. These drugs blocking DNA polymerase the most, interferon, lamivudine, and tenofovir, adefovir. They block the DNA polymerase the most. Now, where's the most DNA polymerase? When your E antigen is positive. If it's been greater than 6 months, by definition, surface antigen, it's chronic hepatitis. These are the drugs for chronic hepatitis B. Now, 4 drugs. Anytime you're in medical school now, and somebody talks to you about how, well, it used to be better in medicine before. They used to think we were special. It's less than it was. You say to them, listen, brother, when you were in medical school, there was no therapy for chronic hepatitis or interferon alone. What did you have to learn? You sat around and watched people develop cirrhosis. Now, when you were in medical school, there was none of these drugs, or maybe interferon. But look at me. I have to learn interferon, lamivudine, and tenofovir, adefovir. What do you got to learn? You had to learn nothing. You say, look, I, right now, as a current 4th year medical student, I am the single best year ever to come out of medical school. This is the most knowledgeable year ever to come out of a 4th year of medical school. This year. Did you know that in the 2,000, 5,000 years of recorded time and history that this is the single best year ever to come out of medical school? The most knowledgeable, the most capable, the most perfect, the most beautiful, able to do more and heal more? So you look at all your professors and all your teachers and you say, you know what? I have 4 years in medical school. You had 4 years in medical school. But you had to learn much less than me. I have to learn much more than you. That makes me better than you. I am the beauty of the world. I am the flower of my generation. And that's what I have to offer.